fishy smelling odor in the vagina with yucky discharge. What is causing it? What can you do to reduce the risk? And how do you treat it? Hi, I'm your local OBGYN. I love women, and let's talk about bacterial vaginosis. Bacterial vaginosis is caused by not one specific pathogen, meaning bacteria, but several, okay? So there's a variety of things that can cause it. The symptoms are generally irritation, a fishy odor. Sometimes the discharge can be like a greenish yellow. It can look like frothy, like bubbly. And some women may not get any significant symptoms at all right? You always carry some of the bacteria that causes this in the vaginal area. And the reason this occurs is because there is a balance of good versus bad bacteria. You need the good bacteria to keep the bad bacteria at small numbers so that you don't get symptoms. It's when that balance is off that these bacteria are able to increase in their number and then cause all of the symptoms. And it can be caused by anything from antibiotics for other things, change in diet, intimacy. It can be from douching. It can be from excessive sweating, hygiene. It can just happen sometimes, all right? So hormonal changes can also be a culprit. Some partners just kind of bounce it back and forth between each other, but it is not an STD. So things that can reduce your risk, all right? Good hygiene. Don't douche. You should use soaps that have minimal dye and fragrance in them. If you get prone to this with certain antibiotic use, you should let your provider know. Probiotics can be a really big benefit because if you increase the good bacterial balance down there, you are less likely to get the bad stuff down there. The treatments are usually a combination of either oral or a gel antibiotic that you put in the vagina. Some people will use over-the-counter boric acid vaginal suppositories as well. If it feels like your symptoms have gone away mid-treatment, don't stop because it may not be completely treated. And if it's recurrent over and over again, you may want to get a swab to make sure it's nothing else.